As we age, one of the most common and emotionally frustrating changes we experience is hair thinning and hair loss. And for many seniors, this doesn't happen overnight. It happens slowly, quietly, strand by strand. What most people don't realize is that hair loss after 50 is rarely just about genetics. It's often about nutrient absorption, inflammation, circulation, and hormonal shifts that naturally occur with aging. Today, I want to talk about how one simple spoon before sleep, using a natural food, may help support healthier hair growth by working with your body's biology, what's not against it. This is not a miracle cure. This is about giving your scalp and hair follicles what they need to function better, especially as the body slows down with age. Hair loss in seniors does not begin on the scalp. It begins deep inside the body, long before the first strand falls onto a pillow or into a shower drain. And this is the part most people never hear because society tells us that thinning hair after 50 is normal, genetic, and unavoidable, when in reality, science shows it is often a biological warning sign that the internal environment of the body has changed in ways that silently starve the hair follicle of what it needs to survive. By the age of 50, blood circulation throughout the body has already declined by as much as 20%, according to vascular aging research. And the scalp, which sits at the farthest end of the circulatory network, is one of the first places to suffer, meaning fewer nutrients, less oxygen, and weaker cellular signaling reaching the hair roots every single day. Hair follicles are among the most metabolically active structures in the human body, and when circulation slows, they are placed into a survival mode, shutting down growth not because they are dead, but because the body is prioritizing vital organs like the heart and brain over hair production. At the same time, chronic low-grade inflammation quietly increases with age, a process scientists now call inflammaging, and this persistent inflammation surrounds hair follicles with inflammatory chemicals that disrupt the normal hair growth cycle, forcing follicles to exit the growth phase early and remain dormant longer than they should. Research published in dermatological journals shows that inflammatory markers such as cytokines and prostaglandins are significantly elevated in people experiencing age-related hair thinning, directly interfering with follicle stem cells that are responsible for producing new hair. But inflammation is only one piece of the puzzle. As we age, the digestive system becomes less efficient at absorbing critical hair-building nutrients like zinc, iron, magnesium, biotin, and amino acids, even when the diet looks healthy on paper, meaning seniors may be eating enough, but absorbing far less than they realize. Studies show that stomach acid production declines with age, and without sufficient stomach acid, protein is not broken down properly, leading to weaker keratin formation, the very protein that makes up hair strands, resulting in hair that grows thinner, breaks easily, or stops growing altogether. Hormonal shifts compound the problem. In men and women alike, aging disrupts the delicate balance between estrogen, testosterone, insulin, and cortisol. And when these hormones fall out of alignment, hair follicles become extremely sensitive to even minor imbalances, shrinking slowly over time in a process known as follicular miniaturization. What's rarely discussed is that stress hormones like cortisol tend to remain elevated longer in older adults. And elevated cortisol has been shown to directly suppress hair follicle stem cell activity, essentially telling the body that growth is unsafe and unnecessary. Sleep quality also declines with age, and this has profound consequences for hair health. During deep sleep, the body releases growth hormone and activates tissue repair pathways, but fragmented or shallow sleep, common in seniors, reduces this regenerative window, meaning hair follicles miss their opportunity to recover, rebuild, and re-enter the growth phase. Scientific studies on circadian rhythm disruption show that poor sleep alters the timing of hair follicle cycling, leading to increased shedding and slower regrowth over time, even in individuals without genetic hair loss. Then there is insulin resistance, another silent contributor. As people age, cells become less responsive to insulin, causing blood sugar fluctuations that damage small blood vessels, including those that feed the scalp, and research confirms that impaired glucose metabolism is associated with reduced hair density and increased hair fragility. When blood sugar spikes repeatedly, it triggers oxidative stress, an overload of free radicals, which damages the DNA of hair follicle cells and accelerates their aging, pushing follicles closer to permanent shutdown. This is why hair loss in seniors is rarely sudden. It is gradual, cumulative, and deeply tied to internal health. Every day of poor circulation, chronic inflammation, hormonal imbalance, and nutrient malabsorption adds another layer of stress to the hair follicle until one day growth simply stops. And yet, this also reveals something powerful. Because if hair loss is influenced by internal systems, then supporting those systems can change the outcome. Research shows that improving blood flow, reducing inflammation, stabilizing blood sugar, supporting digestion, and improving sleep quality can help restore a healthier environment for hair follicles, not instantly, but biologically at the cellular level. This is why topical treatments alone often fail in seniors. You can stimulate the scalp all you want, but if the blood carries inflammation instead of nutrients, if hormones send shutdown signals instead of growth signals, and if the gut cannot absorb what the hair needs, follicles will remain inactive. Hair is not cosmetic tissue, it is diagnostic tissue. It reflects the state of circulation, metabolism, digestion, and recovery inside the body. And this is the truth most people are never told. Age-related hair loss is not just about age. It is about what aging has done to the body's internal systems and whether those systems are supported or ignored. When the body is inflamed, undernourished, poorly rested, and poorly circulated, hair growth becomes a luxury it can no longer afford. But when those systems are gently supported, consistently and intelligently, the body often responds in ways people assume are no longer possible after a certain age. Hair follicles are remarkably resilient. They do not die easily. They wait. They wait for blood to return, for inflammation to calm, for nutrients to arrive, and for hormonal signals to say that growth is safe again. And that is where real change begins. Not in a bottle, not in a quick fix, but in restoring the internal conditions that allow hair to grow naturally. Even later in life, one simple spoon before sleep sounds almost too small to matter. Yet biology shows that timing, consistency, and nutrient signaling can make the difference between a hair follicle that shuts down and one that survives, because the body does its deepest repair work at night when most people are completely unaware of what is happening beneath the skin. During sleep, especially deep sleep, the body shifts from protection mode into regeneration mode, releasing growth hormone, activating cellular repair pathways, and increasing blood flow to tissues that are not prioritized during the day. And hair follicles are one of those tissues that depend heavily on this nighttime repair window. This is where flaxseed, taken as one spoon before sleep, becomes biologically relevant rather than just another health trend. Flaxseed is one of the richest natural sources of alpha-linolenic acid, a plant-based omega-3 fatty acid that has been shown in scientific studies to reduce systemic inflammation, improve endothelial function, and enhance microcirculation, the exact type of circulation that feeds tiny blood vessels supplying the scalp. Research published in nutrition and dermatology journals shows that omega-3 fatty acids help protect hair follicles from inflammatory stress, By reducing inflammatory cytokines that otherwise push follicles out of the growth phase too early. When inflammation decreases, follicles are more likely to remain in the anagen or growth phase instead of prematurely entering the shedding phase that so many seniors experience. But flaxseed does more than calm inflammation. It contains unique plant compounds called lignans, which are among the most powerful natural antioxidants found in food. And these lignans play a critical role in hormonal balance, something that becomes increasingly fragile with age. Hormonal imbalance does not have to be extreme to affect hair. Even subtle shifts in estrogen, testosterone, insulin, and cortisol can send mixed signals to hair follicles, causing them to shrink gradually over time. Lignans help modulate hormone activity by binding to excess hormones and supporting more stable signaling, which is why research links flaxseed consumption to improved hormonal markers in both men and women. This matters because hair follicles are hormone-sensitive tissue. They respond instantly to internal chemical messages. When those messages signal stability, follicles hold on. When those messages signal stress, inflammation, or imbalance, follicles let go. Another overlooked benefit of flaxseed is its effect on gut health, and this may be one of the most important pieces of the puzzle for seniors. As people age, the gut lining becomes less efficient, digestive enzymes decline, and beneficial gut bacteria decrease, all of which reduce the absorption of minerals and amino acids needed for hair growth. Flaxseed is rich in soluble fiber, which feeds beneficial gut bacteria and improves intestinal integrity, leading to better absorption of zinc, iron, magnesium, and biotin, nutrients directly involved in keratin production and follicle strength. Studies show that people with healthier gut microbiomes absorb nutrients more efficiently and have lower levels of systemic inflammation, creating a healthier internal environment for hair growth. Now, let's talk about why taking flaxseed before sleep matters. Unlike fast-digesting carbohydrates, flaxseed digests slowly. Its healthy fats and fiber help stabilize blood sugar overnight, preventing spikes and crashes that increase cortisol, the stress hormone known to suppress hair follicle stem cell activity. Elevated nighttime cortisol has been linked to increased hair shedding and disrupted hair cycling, and this is particularly common in older adults who experience poor sleep or blood sugar instability. By supporting more stable blood sugar and calming inflammatory responses, flaxseed helps create a hormonal and metabolic environment that allows the body to repair rather than react. There is also the antioxidant effect. Hair follicles are highly vulnerable to oxidative stress, damage caused by free radicals that accumulate with age, pollution, poor diet, and metabolic dysfunction. Flaxseed lignans and omega-3s help neutralize oxidative stress, protecting the DNA inside follicle cells and slowing the biological aging of the follicle itself. Research shows that oxidative damage accelerates follicle miniaturization, while antioxidant support helps preserve follicle size and function for longer. Another key factor is circulation during sleep. At night, when the nervous system shifts into parasympathetic mode, blood vessels relax, allowing improved blood flow to peripheral tissues like the scalp. Providing the body with anti-inflammatory fats and micronutrients before sleep means those nutrients are circulating during the very hours when follicles are most receptive to repair signals. This is not about forcing hair to grow. It is about removing the biological obstacles that stop it from growing, and this is why consistency matters more than dosage. 1 spoon taken nightly sends a repeated signal to the body: reduce inflammation, stabilize hormones, support digestion, protect cells. Over weeks, not days, this signal accumulates. Many people first notice reduced shedding, then improved hair texture, and eventually stronger regrowth because follicles respond slowly but predictably when their environment improves. It's important to understand that flaxseed does not act like a drug. It does not override genetics. It does not create instant results. What it does is support the systems that hair follicles depend on: circulation, inflammation control, hormonal balance, gut health, and nighttime repair. This is why research consistently shows better outcomes when nutritional interventions are timed with sleep and combined with consistent daily use. Hair growth is not a cosmetic process, it is a metabolic one, and metabolism slows with age unless it is supported. One spoon before sleep may seem insignificant, but biologically, it aligns with the body's natural repair rhythm in a way few people ever consider. Hair follicles are listening to internal signals every hour of every day. When those signals say stress, inflammation, and imbalance, growth shuts down. When those signals say stability, nourishment, and safety, follicles often respond, even later in life. And that is the science-backed reason why something as simple as one spoon before sleep can support natural hair growth, not by promising miracles, but by restoring the conditions that allow the body to do what it was designed to do. Hair does not respond to intensity, desperation, or large doses taken once in a while. Hair responds to signals, and science shows that the most powerful signal the body understands is consistency, because biological systems do not change overnight. They change through repeated exposure to the same message day after day, especially as we age. One of the biggest mistakes seniors make when trying to restore hair growth is believing that more is better, when in reality, research in nutrition and endocrinology shows that excessive intake often backfires, increasing oxidative stress, disrupting hormones, and overwhelming digestion, all of which push hair follicles further into shutdown. Hair follicles operate on cycles that last weeks to months, not days, and every follicle is constantly deciding whether to stay active or enter dormancy based on what it senses internally: blood flow, inflammation levels, hormone balance, nutrient availability, and stress signals. This is why timing matters as much as content. The human body follows circadian rhythms, internal clocks that regulate hormone release, tissue repair, and cellular renewal. And studies show that disrupting these rhythms impairs hair follicle cycling, while aligning nutrition with them enhances recovery and regeneration. At night, the body releases growth hormone, a critical driver of tissue repair, collagen synthesis, and follicle activity. But this release only happens effectively when sleep is deep, blood sugar is stable, and inflammation is low. When seniors snack late on sugar or eat heavy meals before bed, insulin spikes, cortisol rises, and growth hormone release is blunted, silently robbing hair follicles of their prime repair window. Research shows that even small nighttime blood sugar fluctuations can increase cortisol levels, and cortisol has been shown to directly inhibit hair follicle stem cell activity, signaling the body to conserve energy instead of investing it in growth. This is why a simple, consistent nighttime routine outperforms aggressive daytime interventions. 1 tablespoon of a supportive food taken nightly works not because it overwhelms the body, but because it gently reinforces the same biological message at the same time every day. Reduce inflammation, stabilize metabolism, support repair. Studies in nutritional biology consistently show that moderate long-term intake of anti-inflammatory compounds produces better outcomes than sporadic high doses, especially in older adults whose detoxification and digestive capacity has declined. Consistency also trains the gut. The digestive system adapts to regular intake patterns, improving enzyme production and nutrient absorption over time, which is critical because hair follicles are highly sensitive to micronutrient availability. Zinc, iron, magnesium, amino acids, and essential fats must be present in the bloodstream consistently, not occasionally, or follicles will downregulate growth to protect themselves from deficiency stress. Another overlooked factor is patience. Hair grows approximately half an inch per month under ideal conditions, and aging slows this rate even further, meaning visible results require time for follicles to complete a full growth cycle. Clinical studies on hair regrowth consistently show that interventions need at least 8 to 12 weeks before measurable changes appear, not because they are ineffective, but because follicles require time to exit dormancy and re-enter the growth phase. This is why many people give up too early. They stop just before the biology catches up. Reduced shedding is often the first sign that internal conditions are improving, followed by changes in texture, shine, and strength, long before visible regrowth becomes obvious. Another reason consistency matters is inflammation memory. Chronic inflammation does not disappear instantly. Immune cells remain primed for weeks, and only sustained anti-inflammatory signaling convinces the body that the threat has passed. Research shows that repeated exposure to anti-inflammatory nutrients gradually reprograms immune responses, lowering baseline inflammation and protecting delicate tissues like hair follicles from collateral damage. Sleep itself improves with consistency. Going to bed at the same time, consuming supportive nutrients at the same time, and maintaining a predictable routine strengthens circadian rhythms, leading to deeper sleep and more robust growth hormone release. This creates a positive feedback loop. Better sleep improves hormone balance. Hormone balance supports hair follicles. Healthier follicles improve confidence and stress levels, and lower stress further supports sleep. Quantity, on the other hand, can disrupt this balance. Excessive intake of even healthy foods can burden the liver, interfere with mineral absorption, and cause digestive discomfort, which increases stress hormones and inflammation, the very conditions that suppress hair growth. Scientific literature is clear. The body thrives on signals, not shocks. Hair follicles, especially aging ones, are extremely sensitive to internal chaos. They do not respond to extremes. They respond to stability. This is why lifestyle factors matter just as much as nutrition. Hydration affects blood viscosity, and thicker blood reduces scalp circulation. Protein intake affects keratin synthesis. Scalp massage improves microcirculation. Stress management lowers cortisol. None of these work alone, but together, practiced consistently, they create an internal environment where hair follicles feel safe enough to grow. Safety is the key word. From a biological perspective, hair growth only occurs when the body perceives safety: nutritional safety, metabolic safety, hormonal safety. When the body feels threatened by instability, deficiency, or stress, hair growth is one of the first processes to be sacrificed. Consistency tells the body that conditions are stable. Timing tells the body when to repair. Moderation tells the body there is no emergency. This is why 1 spoon taken nightly, combined with proper sleep, hydration, and gentle daily habits, can outperform aggressive treatments that ignore biology. Hair follicles do not need force. They need reassurance. They need repeated proof that blood will arrive, nutrients will arrive, inflammation will calm, and stress will not dominate. And when that proof is delivered night after night, week after week, follicles often respond in ways people believe are no longer possible with age. Not because aging stops, but because aging slows when the body is supported intelligently. Real change does not come from chasing shortcuts. It comes from respecting how the body actually works. And when you align consistency, timing, and moderation with the body's natural repair rhythms, you stop fighting biology and start working with it. That is when hair growth becomes possible again, not as a miracle, but as a biological response to the right signals, delivered patiently, predictably, and consistently.